All right guys, so it's time to get a little creative. You're stuck at home, you're looking for new ways to work on your terminal knee extension, getting the knee straight. And this is one of my favorites. So this is just a regular playground ball. This is something you'd buy at the store. This one happens to be a little bit deflated, so it's a little bit softer than usual, but it's not even $2 at Walmart or any store like that. It's literally a little kid's ball. What I like to do is come up to my kitchen counter. I like the kitchen counter because it allows me to kind of get forward. My toe can go underneath the cabinets. I set the ball about thigh level. So my knee is down here. Let's pretend this is my surgical knee. My toe is under the kickboard right up against the cabinet. And all I'm doing is I'm thinking of bringing my hips forward toward the countertop. I might sit here doing, an activity. I could be writing, I could be looking on my iPad, I could be doing whatever I need to do, but I can feel the soft pressure of the ball pushing back on the thigh. Now, if I feel like that's not aggressive enough, I can absolutely go right below the knee and do the same thing, and you can see that my ultimate goal, depending on the size of the ball, is to bring my hips, my pelvis, right up against the counter. I can feel the pressure on my heel. My foot is flat against the floor, and I'm just pressing my hips forward, just allowing the back of the knee to relax. Often I feel that patients have a tendency to want to push into the ball, but really, remember, the ball is your friend. The ball is helping to push you into extension. Let it do its job. If I don't have a ball, but I'm still looking to improve extension while I'm standing, working at the kitchen counter, doing anything, one of my other favorite ways to do it is to simply cross my non-surgical leg in front of my surgical leg. I kind of bring my surgical leg up behind it, and so now what's happening is my non-surgical leg in this case is in front of my surgical leg. As I extend my non-surgical knee, it is applying backward pressure into my surgical knee. And so again, I can be here, I can be working at the counter, I can be doing whatever I need. If I lose balance at all, I've got the counter here to stabilize me. I could be brushing my teeth in the morning, I could be shaving, whatever it is, washing dishes. So here's a sink. I could be at the sink washing dishes while I'm working on my terminal knee extension using my good leg to help improve the range of motion in my surgical leg. Guys, these little tips and tricks should go a long way in helping you. The whole idea here is, I want you to understand, it's not about a single episode, it's not about a single workout, it's not about pushing yourself hard for 30 or 40 minutes once a day and then forgetting the rest of the time. The most important part of your rehab are these little micro exposures that you're bringing into your life every hour of every day. And I want you to be mindful. Think of and look for opportunities in your normal day that allow you to work on the range of motion. So if I'm here at the sink and I want to work on my flexion a little bit, on bending the knee, I might come in here, if this is my surgical leg, and I might just lean into the sink. The sink gives me a nice stable surface. I can grab on here. For those of you who are able to get down on one knee, maybe you need to get something out of a low cabinet. The whole idea is this is giving me an opportunity, and I might spend 2 or 3 minutes, literally 2 or 3 minutes in this position, working that knee forward over the toe. There's as little or as much weight as I want through the surgical side, but the idea is that I'm repeatedly exposing the tissue to the kind of movement, direction, and positioning that I want to improve. So guys, if these videos are helpful, please post a comment on YouTube in the comments below. Let me know what you're thinking. Let me know what other questions you have and how I can help you guys answer those questions into the future. As always, thank you so much for watching. I'll catch you on the next video.